Now, a powerful look at survival, stigma, and strength. Two men who once wondered if they would even survive are now living proof of how far we have come in the fight against HIV and AIDS and why the battle is not over.
News4 Jax reporter Brianna Brownlee spoke with them and shares their very personal stories.
There was like death all around.
I hope I didn't leave anything embarrassing in my sock drawer because I'm dying.
It was a different kind of war in the late 80s and early 90s. The AIDS epidemic was at its deadliest in the United States. But some lived to tell the story, and we sat down with two survivors.
I tested positive for HIV in March of 1990. I was diagnosed with what, I don't even know if they still use, full-blown AIDS. In early 94.
Ernie says he wasn't reckless, just human. Fresh out of the Navy, building a life in Houston. But in 1991, the virus that once felt distant started hitting closer to home.
Friends I'd lost to with AIDS were like, probably in their 30s. There was all this really, loss, and I thought, I really should go get tested.
Back then, the test was anonymous. No name, no phone number, just a number on a piece of paper and the weight of whatever came next.
She went for the jugular. She said, okay, your test results came back positive. My whole life crashed in front of my eyes. Yeah, it was very uncertain how long you'd have to live after finding out.
I was diagnosed in 2007.
But the virus had likely been in Justin Bell's body for years, silently. Back in 2001, after a surgery for intestinal cancer, a piece of unsterilized medical equipment was used on him. He wouldn't learn that it was the source of his transmission until a decade later. But in 2007, he got sick. He thought it was just the flu. Tried to tough it out with Tylenol until things got worse.
My partner woke up to find that I was cold blue and unresponsive, and my lungs had collapsed from what is known as PCP pneumonia, pretty common for individuals with AIDS.
Justin fell into a coma. He couldn't move or speak, but he could hear. Doctors told his partner to call the family. Justin didn't believe in religion, but one came anyway, and something shifted.
For the very first time in 3 months, I opened my eyes.
That was the moment Justin knew he wasn't done yet. Waking up was just the beginning. Justin still had AIDS, but he also had something else, a second chance. The medication wasn't easy at first, especially for Ernie, who was diagnosed back in the 90s. He was on AZT, the first HIV drug. It had to be taken every 3 hours. It made him sick, exhausted, and barely able to function. A few years later, Ernie ended up in the hospital with meningitis and went from 20/20 vision to being blind, and his HIV advanced into AIDS. Then a social worker came in with the news that he had been kicked off his company's insurance. And then came a lifeline.
Florida Medicaid saved my life.
And with it came a new medication.
I've got something that's gonna make your T cells go up. I said, okay. Fat chance, doc, what are you talking about? He says, no, I'm serious.
It was the drug called Invisor. Slowly, Ernie's immune system started to fight back.
Every time I went back, my T cell count started to go up. I was thinking, I'm not gonna make it, to, okay, I'm gonna make it.
Back then, treatment meant multiple pills a day, side effects, strict routines. Today, it's down to 2 pills, and for some, even better, a long-lasting injection every few months.
When I began
for Justin, it's more than just science, it's survival.
Modern medicine has helped me.
Modern medicine saved their lives, but what breaks their hearts is knowing it's still happening.
I was talking with my HIV doctor. He says, I still get called to patients in hospitals who've been diagnosed with full-blown AIDS here in 2025. And I asked him, I said, how's that possible?
The answer, both men says the stigma remains, along with a dangerous belief that HIV is something that only happens to certain people. Ernie says survivors live on, but no one truly comes out unscathed.
And it still haunts me to this day, the number of people that I knew who died from AIDS complications.
Both men say that the medication is available, the knowledge is available, but what's still missing is urgency.
We can't do this alone, but it will be our community that marches just as well for a Pride March as we do for an AIDS March that's going to push us back and get our community to zero.
That was Brianna Brownlee reporting. It is a
Pretty
fight
emotional
and a
stories,
struggle,
yeah.
absolutely. And we have committed the whole month, since it is Pride Month, to telling stories, from the perspective of people who are living this. And you can read more of those stories in case you've missed them on our website, newsforjax.com.
And when you hear they didn't think that they had a chance at surviving, to hearing the fact that they're living life, it sends a very powerful message.